Antonio, what's your main role at DPH?
So I am the vector-borne disease epidemiologist. I also cover some general diseases as well, but mostly the bug diseases. We basically interview cases, we classify cases based on case definitions, respond to any outbreaks, do outreach, things like that.
And I know you said when we started, you were not originally very fond of bugs, and now this is your specialty with DPH. So, how did you get into this specialty?
Yeah, I was always interested in infectious diseases. When I got to undergrad, I wasn't really sure what group of infectious diseases I wanted to go into. I wasn't sure if I was interested in foodborne diseases or injury epidemiology. Certainly, vector-borne diseases wasn't really on my radar because I didn't like bugs. I had an internship at Columbia University in New York City, my third year in undergrad, and they place you with a mentor, and I was just lucky enough to get placed with the New York City Department of Health in their vector-borne disease program. And I was like, "Oh, I'm really not going to like this." And turns out I it completely changed my view on everything, which is why you should always have an open mind. My mentor was an entomologist. He knew the craziest bug facts that blew my mind, that some butterflies taste with their feet, just little things like that. And on our lunch breaks, he would go identify bug or butterfly species, and I'd follow him and just I'd learn a lot. And I was always interested in animals too. And I never like this is gonna sound weird, but I never put two and two together that bugs are animals. And when you think of animals, you think of the cute, fluffy animals or something like that. But I realized that this would be kind of a cool disease group to get into to study both insects and diseases. And it's super complex because a lot of these insects have complex life cycles and a lot of people just don't know a lot about them. So yeah, so I studied that. I went to grad school at Cornell for vector-borne diseases. I had to start. So I was a master's student with undergrad students in entry level entomology courses because I had no background in entomology at all, which is the study of insects. And I started from the bases and kind of worked my way up. And now I have a master's degree in entomology, and I managed a mosquito control program in Pennsylvania. And after that, I am now working here as the vector-borne epi.